Hi everyone, I'm Alicia, and with Gigi, Maggie, and Max, we made the project DKA Away. Our project is about a complication that occurs often in patients with diabetes. Diabetes is a disease that causes people to have a lack of insulin. The use of insulin pumps, glucose monitors, and insulin injections help diabetes patients to maintain normal insulin levels. However, improper management of insulin levels, such as a blocked insulin pump, can lead to serious complications called diabetic ketoacidosis, also known as DKA. When diabetes patients lack too much insulin, their blood becomes acidic and the pH value drops. If the pH level drops too much, a person can fall into a coma or even die. Patients with type 1 diabetes are most likely to get DKA. They do not produce any insulin at all, as opposed to diabetes type 2 patients, where they produce insulin that is not as effective or not enough to maintain glucose levels.
Our target population is adolescents with type 1 diabetes. Because DKA is caused by mismanagement of insulin levels, the majority of the time it is common for adolescents to not take their insulin as described or forget to take it altogether. 50% of all diabetes admissions in adolescents are due to DKA, and about 200,000 people under the age of 20 have type 1 diabetes in the US alone. There are 40,000 new cases of type 1 diabetes each year. By decreasing the risk of DKA in adolescents with type 1 diabetes, it would minimize hospital visits and save money. Due to the large population of Americans with type 1 diabetes, this presents a huge market for our product. Continuous glucose monitors have been used to replace the need to take a blood sample from a finger prick. There are small pods similar in appearance to insulin pumps that are attached to the stomach. They have a tiny sensor that is inserted under the skin and automatically reads glucose levels. The data can even be transferred to a smartphone. There are some imperfections with CGMs, including that they must be refilled and sometimes blockages may occur. Because CGMs are imperfect and so widely used, there is a lot of room for improvement in the market.
Our solution to this problem is the creation of an early detection system that we will embed into a continuous glucose monitor. The goal of this system will be to monitor blood pH and alert the patient when the pH drops below the healthy level. This threshold is 7.35. While this is not a diagnostic of diabetic ketoacidosis to have a blood pH below 7.35, it will allow the patient to be wary of other signs and symptoms of diabetic ketoacidosis. Our prototype has two main components. The first is an Arduino, which is an open source electronics platform, and the second is a pH probe that is compatible with the Arduino. This Arduino allows you to write and execute code. In this image on the right, you can see the Arduino, which is hooked up to a potentiometer, which is the blue circle, and a red LED. The potentiometer is a stand-in for the pH probe because this was not an option in the Tinkercad software we used to create this virtual prototype, and the red LED is what will light up to warn the patient when their blood pH drops into the acidic region. This slide describes how the signal is processed on our device. It begins with the pH of the solution in which the pH probe is submerged. The probe converts this pH into a voltage, which is read by the Arduino. The Arduino is capable of converting that analog voltage signal into a digital signal, which can be sent to the LED. If the pH read by the probe is below the threshold of a pH of 7.35, the LED will turn on. If the pH is above 7.35, then there will be no signal sent to the LED and the LED will remain off. This is how we can use this system to alert the patient with a red LED if their blood is in the acidic range.
Next, we have a demo showing how DKA Away works. When the sensor is exposed to an unacceptable pH, shown on the left here, you can see the red LED turns on. And then when the sensor is placed back in the solution with an acceptable pH, you see the red LED turn off again. In this project, we chose to leave out how our device would fit into the CGM, but here we have a sketch of what our final DKA Away prototype would look like. As you can see, the probe and the Arduino are encapsulated by the CGM pod, and the probe measures the pH of blood, and the LED light is left exposed through the top of the pod. DKA Away is a solution that creates a simple way for diabetes patients to monitor multiple aspects of their health all through one device. decreasing the chance of hospitalization from DKA, and helping younger children or those new to diabetes to better understand their disease. That concludes our presentation. Thank you for your time and feel free to contact us with any questions.